Well, hello, everybody, and welcome to our Facebook Live session. We are so happy that you guys are here to join with us. I have a special guest, Ayana Melvan, and I'm super excited that she is here to share with us. We are doing a conversation because Black stories matter. And we're continuing our conversation with maternal health and race. And I'm super excited that she is here today to share with us. But before we get started, you guys know LunaYou is a maternal well-being program that helps and comes alongside women that need it the most. We know that pregnancy is hard, and pregnancy and motherhood is not easy. And so to have that support to support a woman's well-being is what we're all about. Each woman, we're starting with 25 women, and the first 25 women to come into the program will receive a free Fitbit and a blood pressure cuff, and then weekly check-ins from a well-being coach, which is me, to really help to make sure that your well-being is a priority. So our spots are filling up fast, and so we have a limited number of availability. So if you know someone that could benefit from this, that's expecting, we would love to have them a part of LunaYou and have them a part. That's the best gift that you can give a woman to do that. So either comment on this, message us at I am LunaYou on Facebook, and we'll be sure to reach out to them to get them connected. So I'm super excited to have this conversation. Not only just to have this conversation because the conversation needs to be had in the telling of stories, but because it's at the eve of Juneteenth. And I wanted to talk a little bit about Juneteenth and what does it mean and what does that mean for us today and how can we honor it in like maternal health? What does that have to do with anything? And so if you don't know, just simply put, Juneteenth is a celebration of just the freeing of slaves. And it happened in Texas. It was the last state to free their slaves. And it was a fully emancipation of all of slavery. And so it's a day that is commemorated by African Americans and all of America to celebrate the abolishment of slavery. And it's a great celebration that has happened throughout the years. My personal community, we celebrate it every single year. And one of the things that I absolutely love about it, not only is it the food, the festivities, and all of the great things, but the biggest thing about it is we usually just have someone to come and just to tell their story, right? Their story of fight, something that they have gone through, that they have overcome as a Black person. And that makes a world difference to sit at the feet and to listen to somebody's story. So I'm super excited to have Ayana here today to share her story with us. We can learn from this. One of the biggest things that we've come to know is that Black and Latino women, they have the highest rate of maternal mortality rates and morbidity rates, meaning complications or some type of problems in pregnancy and in childbirth. And that it was easier to give birth 30 years ago than it is to give birth today. And just something is not right with that. And the only thing that research tells us that it may not even be your education level, your access level, but the factor is just your race. And so I'm super excited to have Ayana here. A little bit about Ayana is she's a senior project manager for education initiatives and the lead for Rhode Island After School Network at United Way of Rhode Island. Ms. Melvan started working with youth programming and community development by helping at-risk youth become exposed to opportunities aside their normal learning in neighborhoods. When she was young, at a day camp in her hometown as a counselor in training. She has helped design, run, and advocate for youth programming outside of the school day that impacts young people and their families for over 20 years. During her work with Hanson, Ayana discovered that some experience inequities attributed to the color of their skin and their social economic status, which we see in the maternal health world as well. These youth are not afforded the same opportunities as their counterparts. She has made it her life to advocate for youth and their families through anti-racism work and has given equal opportunities to help ensure better quality of life. Ayana says looking at systems and changing them is important. We must work with urgency to combat old traditional inherited biases and write a new narrative where equitable practices are woven into the American education system and sustained. I love that so much. I love that. And so, hi, Ayana, how are you?
Hello. I'm doing well. Thank you so much for having me on here. This is fantastic, and happy Juneteenth.
Happy Juneteenth to you as well. Like I said, the greatest thing to recognize this is the power of our story, right? Where the story still fights on. And I know that we each have a story. Each one woman in LunaYou has a story. And I think it's great to hear and acknowledge other stories to bring awareness to this today. So just tell me a little bit about who you are, the work that you do, and a little bit about what makes you an authority in this topic of maternal health and your experiences.
Sure. So I currently work, like you said, at United Way of Rhode Island. I just started working there this past December. I was on maternity leave, but was hired in the summer and then transitioned. And I just transitioned out of a job where I was the initiative director working on some anti-racism work and some work around social cohesion in the city of Cranston, Rhode Island. Great group of people that were really trying to determine what was holding not just young people back, but also adults, senior citizens, businesses, and how to bring to get people together, have a sense of belonging is what they were searching for. And they're still searching for in Cranston. The work has still continued. The pressure of the work, though, was tremendous, especially I was pregnant twice during that job, during that role. And I, was determined throughout the work that I was doing anti-racism work. And so it was hard to enter spaces as a pregnant Black woman talking about race, and especially because it's emotionally charged, people are very defensive. Before that role, for years, as you mentioned, I've been working with out-of-school time programs. And so that's any program that's after school or during summer or on our vacation times. And so there's several different capacities that I've done that work. I've been on the front lines, kind of, the counselor in training as a youth. And then I was a program director in Cranston. I've been in all 3 states working in out-of-school time programs. So started in Massachusetts, then in Connecticut, and now in Rhode Island. Mm-hmm. And now I'm running the After School Network. I'm also the After School Alliance ambassador, so at a national level, doing national advocacy. And we have some great federal delegation, like Congressman David Cicilline, who champions the work of out-of-school time. So it's really great to have him and be in his state and be supporting the work that he does to keep our programs open in terms of federal dollars. So a lot of good advocacy work, and it's all because I'm a product of after-school programs. My brothers are as well, and it was those moments where we were out of school that really enhanced our educational experience and made us resilient, especially as we dealt with a lot of different racial structures and institutional racism, systemic racism as we were growing up. So that's kind of my little bit of a background. And then to answer your question about maternal, why I care about maternal health, I think before I even became pregnant or even thought about having children, just everybody would ask me, like, when are you going to have kids? When are you going to have kids? When are you going to have children? That big question, right? Especially as you're coming out of your 20s and going into your 30s. And I would always tell people that I had 500 kids because my programs, and I'm like, I don't need kids. I have 500. I know, and I've seen the difference of healthy maternal starts and what happens while they're in first grade, kindergarten, all the way to college. Mm-hmm. I've seen it, and I've heard the stories, and it's tremendous, the difference and the different and the gaps that are lifted up and the disparities when you hear of children that, for example, are breastfed and their mom tells you they never had the opportunity to breastfeed. Typically, they're women of color. Yeah. And so it really kind of is shocking to see the differences in how children interact with their parents. And you can tell that, it starts at 0, right? It starts at 0 years old. And so that's why it's always important for me that while a woman is pregnant and has a baby in her belly, that's when we should start to really think about her health and how
Yeah.
she is going to be able to be not stressed and kind of move through creating a life and bringing life into this world, and where she feels like it starts, and her choices around that are so critical and important to her health moving forward and to the child's health moving forward.
Yes, absolutely. And you can't stress that enough. Like a woman's overall like physical outcomes and what happens to them really, really matters on how they're treated and how they feel and how they carry stress. And all of that then drives into their overall well-being. And that's why this is so important that we focus on that. So I know in just talking to you just earlier that you have even your personal story of how biases or like you weren't really heard in your pregnancy and while giving birth to your own children personally. Can you tell us more about that?
Sure. So I have two children. I have them in a row. They're 16 months apart. And I was told my entire life that I wasn't going to be able to have children. And so, long story short, I finally went through about 8 OBGYNs and finally got to an OBGYN who seemed to listen, and he still listens to me. But what's difficult about where he is in his practice is that they share patients. And so it makes it hard to lock down an appointment with him.
Mhm.
And so that kind of started that journey when I was pregnant with my daughter, and she was my first, is that I was constantly feeling like I had to fight to have an appointment with my doctor. And my counterparts, especially my white friends that I'm very close with, were telling me they didn't have that happen to them, even at the same practice, that they could still meet with their doctor. And my doctor was even shocked that there were moments where I was requesting him, but not being heard. And so that was pretty frustrating. It happened with my daughter, and it happened more so with my son.
Mhm.
And just seeing different people is scary and stressful because you're having to repeat yourself. And as a pregnant woman, you don't always remember. And so you can't remember the day to days. And when you have a doctor that can follow you on your journey, it's so much more healthier on your stress level, for them to keep up with the different stages and milestones that you're going through as in your pregnancy. And so, I went from being called morbidly obese to having multiple diabetes tests. It was torturous. And finally, when you have the different births, they both were very, very different experiences and very traumatic experiences. My daughter, she was a very quick birth. She was my first. It was unheard of. I woke up in the night and was like, she came a week early. I was like, I don't feel right. Went to the bathroom, went to get back in bed, and my water broke. And so, what they tell you is, oh, track your contractions. And I did. And I noticed that my contractions were 2.5 minutes apart.
Mm.
So I called, and the woman on the phone didn't believe me. She was like, no, you must be timing it wrong. Calm down. I was like, okay. And she said, if you feel like they're 2.5 minutes apart, you can come in. So she was like, but I would wait till the morning. So
Wow.
I said, well, I feel like they're not, 3 minutes apart. I feel like they're less than that. I'm going to come in. And I got off the phone with her, and I believed her. So I got in the shower to try to calm down, and that did not work because contractions are contractions. And so, we got to the hospital. It was a whirlwind. It was 2 hours later, my daughter was here. I was at the hospital for 45 minutes.
Wow.
Um, During that time, I had to tell them my medical history. I have alpha thalassemia, which is a blood disorder, and it's very rare to track. A
Mhm.
lot of times they find it in older adults, but because of my condition, they found it early. I have a
Right.
couple autoimmune deficiencies as well. So I was trying to tell them I see a hematologist every 3 months. I've been seeing her for 7 years, and they didn't believe me that I had alpha thalassemia, and they didn't believe me that I had a hematologist. She
Wow.
needed to be called because potentially I could have bled out.
Of
And
course.
so when you're having a baby and you're panicked already, you're scared of the uncertainties. It was my first child. I didn't know how to act. And so, or advocate for myself. And neither did the people in the room who were with me, but we had to keep pushing. And I was told that I needed to calm down. I was told, you're shaking, you need to calm down, you're making it worse. And I'm like, I don't know how I'm making this work, but I feel like my baby is coming. And boy, was she coming, because it was 1.5 pushes. The midwife came in and said, I can see the hair. While they were arguing, the two nurses, about how dilated I was. One was saying 5 centimeters, another was saying 10. And this is all happening in front of me. And everybody's like moving around you. They didn't even get an IV in me. I had no fluids running in me. I just, boom, had a baby. So no drugs, nothing, even though I had requested all of that. So your birth plan kind of goes out the window. And they didn't really care about my birth plan, which was really odd. So one of the weirdest things that had happened was they really mixed up our paperwork with my first child. And so, I kind of just wanted to get out of the hospital. There was so many traumatic experiences, including trying to breastfeed. And the woman who was in charge of showing you how to breastfeed your child, the lactation specialist, she actually stuck her finger down my daughter's throat, and my daughter vomited for the first time in front of me. And it was like, we were like, okay, what is this? And a nurse came in and gave me my daughter back and said, no, this is like, sorry about this interaction. So one of the weird things that happened, which I'm sorry, I forgot to tell you about this, but we had several people come in and question my health insurance.
Wow.
Because they didn't believe I was married. My husband is white, and full disclosure. And so he was getting really frustrated. And a woman came in and said that they had to visit my home to make sure it was safe for my baby.
Wow.
And I forgot to tell you this, and he reminded me after we had spoke the other day. He was like, make sure you tell her that part. They did visit my house and had complete wrong information. The woman was embarrassed. She was like, we never visit homes after a child is born unless the mother wants that. And so it's just kind of embarrassing to be treated that way. And how they were trying to put me on benefits right away. They refused to put my husband's last name on the information at the hospital for both my children.
Wow.
So that was pretty frustrating.
It just happened one time. It happened like a second time, and all of this is rooted in assumption and bias, right? Like, just
same hospital.
Bias of just, and literally the facts are written down in front of me to have it, but because of the assumption, I think that it's otherwise. Wow.
Yeah, and literally same hospital. So just bizarro kind of things happening, and not being believed. And my doctor was infuriated that he wasn't called. He had words with the nurses about not listening to me about my hematologist. And still to this day, from my first birth, my hematologist has not gotten my blood work, which she was pretty frustrated about, because we try to keep track of it to keep me healthy. My second child was so traumatic. I think for me, it's hard to talk about, but, for just in the interest of time and wanting to get the message out there, I think the nurses admitted, not all of them, they admitted to me that they'd never been through racial equity training, and they didn't understand what implicit bias is. A lot of them felt like, well, I'm not racist, so I don't kill Black women during childbirth. I told them it's not about that. I told them it's about listening, and they agreed, about pain level, about assuming that, oh, you're a Black woman, so you're strong. And that was kind of the assumption, right? And so as I was kind of going through, and they're telling me, oh, this birth's going to be different. It's going to be faster because your first was so fast. So, right when you have really strong labor contractions, you're going to have your child. Well, I was in labor for a week and a half. I was induced twice.
Wow.
And so finally, when I was having him, they were having a very hard time locating his heartbeat. And so that was a process as well, trying to explain to them I had a really good rapport with one of the nurses. And because of how they are set up, which is really odd, she was just gone. She was off. She went home, and another nurse came in. And that process is very strange to me, because my mom remembers her childbirth. She's like, I had the same people the whole time. And my nurse had asked to stay because she was worried about locating my son's heartbeat, and she was trying her hardest to listen to me and figure out what my needs were while also doing her job. But that was one person. And this is a large staff that's not up to her caliber and up to her speed. And she was willing to listen to me. So I did want to lift that up. But what was troubling is that because there was so much confusion and new people put on and the process was so fast, his heartbeat was just not there. So they did a process which was called tethering, where they take a pretty much like a string, and they put it in the top of the baby's skull while they're inside of you, and then they attach it to the inside of your thigh to help the baby stay coming down, that down process.
Right. Wow.
So they missed the first time. And it's extremely painful for them to do this process. They literally take their hand and they're putting it in you to put this tether.
Right.
And so I didn't want to have it happen again. It was so painful, but they insisted on doing it again. When they did it again, my water broke. And they were like, okay, he's tethered. We can hear his heartbeat. But as they did that, they decided to up I forgot the word again, the Pitocin.
Yeah.
Right. And all along we had issues with that. I had some allergies, including allergic to corn, and they were pumping me full of this sugar, and it was corn. So I was like literally itching like a drug addict. So they're like looking at me like I'm crazy because I'm itchy. And I'm like, is there something in something that you guys are giving me? And they couldn't figure it out. And my husband finally looked at the bag and he was like, you guys are pumping her with corn syrup and she's allergic to corn. Like it's on her chart. And that was an argument. They called the pharmacist. The pharmacist didn't even know that dextrose was sugar from corn. It was like, going through that. So I'm having an allergic reaction. And then I'm starting to feel a lot of anxiety because I can tell that something's wrong. Yeah. And so I told the nurse, I said, there's something wrong. This is not normal contractions. And she didn't listen to me. And so finally the doctor came in and was kind of impatient with me. She was like, listen, you need to calm down kind of attitude. And so she's like, hold on, let me just check something. And all of a sudden I started bleeding out and they coded me. So it's a code pink. The entire hospital was alerted. My doctor was in surgery and he had to run out of surgery. He was in surgery with his wife. He had to run out of surgery. And it was just a whirlwind. It was the 10-minute process of me almost dying and my son almost dying. So why they coded me is because my son's heartbeat stopped. Wow. And so I had to hear his heartbeat slow down and then just disappear. Wow. While I'm in tremendous amounts of pain. Yeah. And so during all of that, when you don't think anything can get worse while they're trying to bring me down to the room, you have a woman coming in saying, oh, so we're going to bottle feed this baby. We're going to give this baby formula. And they're a breastfeeding hospital. And I was like, what? So it's almost like they're predicting already my death, that's really what I thought in the moment. I'm like, so am I not going to make it? Is my son not going to make it? So that's what I was screaming. Is he dead? Is he dead? That's what I remember yelling. And so my husband said it was the worst 10 minutes of his life. And the anesthesiologist came running in while they were cutting me open. Wow. So it was pretty traumatic. And I keep going back to that whole thing about listening and taking people more seriously when they're trying to explain something to you. And at the beginning, it was like, hey, I was like, don't give me any pain medication because we're already so far along into this process. I was like, let's just kind of go through the process. And so it started off with listening, but then it ended with like, nope, she doesn't know what she's talking about. So let's stop listening to her. And I think that that's kind of strange.
Right. Right. And I love how you said that because LunaYou, we're all about like putting the woman back at the center of her pregnancy, right? So that she's the focus and not necessarily like the healthcare center be the focus. And if the woman is the focus, then you listen to her voice, right? Because it's from her that all things radiate. The baby comes out of her. It's about her body, her health, her that. And so listening is something that costs absolutely nothing, right? It's just saying this person knows her body than we probably do. We know all of the technical terms, and it seems like in your case, they didn't know even the technical things or how things interact or what needs to happen. But then also a woman knows her body, and giving women that ability to find their own voice and to speak up for themselves is very important. But then it's one thing to have someone speak up for themselves, but then it's also another to have someone to be able to listen when you do speak up for yourself, of saying something doesn't feel right, or I'm telling you this is the level of pain and I want to be treated just like every other person. This fight, I tell people all the time, is that this fight is not to be treated better than anybody, not to be treated better than any other woman that comes in to have the baby. The fight is just to be treated as human and just to be treated as normal. And that when one person tells you one thing, no matter what you assume, no matter what your bias is, that you listen, you listen, you listen, and you get all the facts that you can to make sure that there's healthy birth outcomes for all women. And that's really important. That's what LunaYou is about, to really help that, especially for Black and Latino women, to really have their voice heard, and understood. And it's crazy that you're a professional, you have education, you work every single day, and they still are like, I don't believe you, you know? And
Yeah.
so just imagine for women though, who don't work or who don't have private insurance or who don't have that, how they are then treated based off of just what people see on a paper. Like that's just something that we're looking to fight against, that everybody has fair and equal access to great health care, especially while carrying, and then has a great well-being overall.
Yeah,
Thank
and I think, yeah, it's interesting because my doctor did come in after and spoke with me, and he could tell how I was feeling. And in both instances, he was like, "We're gonna let you go home early," because he knew home was better healing for me than there. But I think there's a lot that the hospitals need to change over. They should allow you and afford you the opportunity to stick with your doctor, and like you said, make you feel like a human. And that's what human interaction is. You stay with the human that knows your body the most. Keep you with the nurse that is making you feel the most comfortable talking to you and saying, "Hey, who do you want to be a part of your team?" It's a big process bringing in life, and we're treating it like it's nothing. We're treating it like it's whatever. And I know at every level that they experience, death in this process with women. And I know from my experience that race plays a massive role in Black women being at that top of that chart.
Yeah.
And I know that I can't emphasize it enough about the listening component, where we aren't even given an opportunity to be listened to.
Yeah.
And my friends were telling me these weird, like, we got to tell our birth plan so far in advance, and it's just, and that those opportunities were never given to me. And so,
That's
yeah,
wow.
the whole
Yeah, when
process.
you start to cross and compare, you start to see the disparities and the discrepancies between one story to another, where it's like, oh, that didn't really happen. And I think it's important that you know that you had that one advocate that was for you too. Or even when your mom said that she was even birthing you, she had like a whole team that was there the whole time. And that's why we find it important. Even now today, we have women in our program that are birthing their babies and calling me in terms of like, okay, I just need an advocate. Does this sound right to you? Does this, that? And that's what doulas are for. And that's what a trusted care, and finding a trusted, physician, OBGYN, midwife to help is really too important as well. And so we have great ones that work with LunaYou, that partner with you, LunaYou, that are on our advisory board as well, that have been great resources for a lot of our women in terms of things to look for and things to stay away from, to really avoid some of those biases. But it's just really information and listening. Communication is really key to help prevent a lot of this and to give great outcomes, especially in maternal health.
Agreed. Thank you for all the work that you're doing. It's needed.
Yeah, thank you so much. And thank you so much for telling your story. I honor you for your story. I'm so grateful that you are still here to tell your story and to help other women who are having babies every day. And so thank you so much. We end our sessions every time the same, and we say that you are magical. So you, Ayana, are definitely magical. And you who are holding your baby, you are magical. And don't let anybody dim that down. You are magic. Happy Juneteenth for all those that are listening. And I'm happy that we can continue this story to just have great outcomes for women everywhere.
Thank you very much. You are magic too.
Thank you so much. Thank you. Well, thank you, everybody. If you have any other questions or want to get connected, visit LunaYou.com or visit us on our Facebook page at I Am LunaYou. We are so happy. Thank you again. And that's it.